Hello and welcome again to everyone. We will start now our session on addressing the causes of climate change, fossil fuels. For those of you who speak Spanish, we have interpretation available. You can enable it by the interpretation button, Zoom bar. This presentation will be in English, and I'm very pleased to introduce to you GCHA's campaign leader, Shweta Narayan, who will be telling you about the impacts of fossil fuels and some strategies used by the health community to address the cause of climate change. So big welcome to Shweta, and I will let you take us off.
Thank you. Thank you so much, Milena. And good evening, everyone. I know it's actually good morning, good afternoon, good evening. Where I am, it's evening, but do recognize that we are all from different time zones and really excited to be here and to share some of my experiences. I'm going to share my slides. So let's see if this works. You can see the slides, right? Perfect. Thank you so much. As Milena said, that I'm going to talk today about the root cause of the climate crisis, fossil fuels. And before I do that, I just want to kind of like give you a layout of my presentation. I'm going to talk about my presentation is split into 4 parts. Where we're going to talk about the reality of the crisis that we are facing, the multiple crises, including climate crisis. Um, we'll examine the root cause, which is fossil fuels, and the diverse health impacts of fossil fuels, and the health impacts of climate crisis. This is the first sort of 3 segment, and there we will take a break. We will have a little bit of a discussion, and there will be an opportunity for you to share your experiences and if you have any questions, and then we'll move to the 4th segment of the presentation, which will be about the role of the health community, especially the health professionals, and how they can take leadership in climate action and addressing the climate crisis, especially fossil fuels. So that's the layout. And with that, just in terms of what is the reality before us, the reality before us is that our planet, our Earth, is facing unprecedented challenges. We are in the midst of triple planetary crisis. We're rapidly losing our biodiversity. Most of our air, waters, and land are polluted, and our climate is rapidly changing. Just to kind of highlight the extent to which we are facing this crisis and why it's called a crisis, according to the Intergovernmental Science Policy Platform on Biodiversity and Ecosystem Services, we are witnessing a rapid decline in nature, and we could lose over 1 million species within decades. That's the extent of the biodiversity crisis we are facing right now. There is another examination, a statement, concern that United Nations Environment Program stated, where in context of sustainable development goals, UNEP says that loss of biodiversity is undermining efforts on 80% of the assessed SDG targets. And so it's making it even more difficult to report progress on poverty, hunger, health, water, cities, and climate. And this is all because of the biodiversity crisis. Then we have environmental pollution that further complicates the crisis that we're facing. Air pollution, you must have, and you're all well aware, increases the risk of cardiovascular and respiratory disorders. Water pollution increases the risk of waterborne diseases like cholera and typhoid. Collectively, again, according to UN assessment in 2019, pollution caused estimated 9 million premature deaths. That's 1 in 6 deaths worldwide were because of pollution. So that's the extent of the pollution problem. In fact, we have toxic chemicals like plastics in our bodies, in our food systems, in our air and water, everywhere. So that's the extent of the pollution crisis that we are facing. And then, of course, we have the climate crisis, which is, again, something.
93% of Americans.
Sorry. Yeah, and then we have the climate crisis, which just paints a sobering picture of the reality that we are in. You have heard this, and as a campaigner, it's my job to keep repeating the message. The climate crisis is a health crisis because it threatens our air, water, food, shelter, security, all the basics on which human life depends. And that's why the World Health Organization called climate change as the greatest risk to human health in the 21st century. Now, as I was putting together this presentation, I started looking at the crisis, the climate crisis that we're facing, and the disasters that have happened just in 2024 alone. And it's a very sobering reality. It's sobering because the year is not over. And this was something that we saw throughout, when we started mapping disasters. If you look at floods, if you look at droughts, hurricanes, heat waves, landslides, disasters, if we were to plot this on a map, I wouldn't be surprised if any part of the world is safe. And that's the reality of the climate crisis. No one is safe. Everybody's life is affected to varying extent because of the climate crisis. Now, that's the reality that we live in today. And that's important to understand that and communicate that, because in a lot of minds of a lot of policymakers, unfortunately, when they think of climate crisis, they think of the future. And the reality is that climate crisis is here today. We are all affected by it. We are all impacted by it. This is not a distant future that we're talking about. This is our lived experience. This is our lived reality. Now, what's the cause? What's the root cause of the climate crisis? And that's fossil fuels. When we think of fossil fuels, coal, oil, and gas, we must remember that at every stage of exploration, production, consumption, disposal, or site closure, fossil fuels harm our health, across this entire life cycle, and they affect human health across the human health life cycle. So from fetus to elderly, the fossil fuels have an impact. Sorry. And in the next few slides, we will look at some of those impacts. Now, yeah, most of us would, and all of us would be well versed about the air pollution impact of fossil fuels. Now, air pollution, which is largely caused by burning of fossil fuels, cause, again, an irreparable damage on our lives and on the lives and the well-being of our children and our family. According to estimates now, air pollution causes 8.1 million premature deaths annually. And that's a number that we cannot ignore. And these are not numbers. These are mothers and fathers and children whose lives are shortened because of the crisis of air pollution. But when we talk about fossil fuels, air pollution is one of the health harms. If you look at the research that is before us, we will see that fossil fuel cause harm to our central nervous system, to our neurological systems, to our reproductive systems, to our respiratory systems, of course. They cause cancer, they cause early mortality. Every part of our human body is affected because of the chemicals released because of fossil fuels, either exploration or burning or disposal. So fossil fuels harm every aspect of our life, through various chemicals and through various toxins, every part of the human body. And these are not what I am saying or somebody is saying. These are all documented, established facts. And that's the nature of fossil fuel harm and impact. Now, some of these chemicals not only affect immediately or in short or medium term, but some of these chemicals remain in the environment over decades and have impacts which is intergenerational. So if, in many cases, there are the exposure that happens, which is then carried on for generations in the families. So that's the nature of the harm that we're talking about. We're not talking about just 6 months or 6 years or 60 years, but sometimes it's over generations that the harm is manifested because of fossil fuels. So that's the danger of this industry. Now, we so far talked about chemicals, pollution. The other aspect of harm that is often not talked about, but has very tangible health effects, is the social harm of fossil fuel industry. So we're talking about forced displacement of indigenous people, corruption, sexual violence, gender-based oppression, substance abuse, road traffic accidents. We're talking about mental health impacts. We're talking about whole economy-wide impact that marginalizes a certain segment in society. We are talking about reduced life expectancy because of the environment and social conditions in certain parts of neighborhoods which have fossil fuel industry. All of these impacts, which are classified as social harms, have very tangible health impacts. And this becomes important for health professionals to think, consider, and incorporate in their messaging, because these are all because of the fossil fuel economy, a social and economic model that this industry perpetuates. Now, the third stream of harm is the risks because of climate disasters. Now, this is interesting, and this is fairly, I would say, recent phenomena that has started getting documented. Most of the fossil fuel infrastructure, if you see, are in the coastal areas or low-lying, flood-prone or extreme weather-prone areas. Because of their location and the kind of products these fossil fuel industries store and manufacture, they are a risk when it comes to extreme weather events. We have seen that since Katrina in 2005, when hurricanes caused massive oil spills, and those oil spills have still not been cleaned up. The toxic impacts still remain in the communities where the spills had happened. So there is climate induced, and every time there is a hurricane or a flood, you will, if you look, you will see a news article of unprecedented release of toxins in the air from a refinery, or a spill or a chemical contamination or oil spills that have happened that have taken years to clean up. And sometimes the chemicals, as we discussed earlier, remains in people's bodies for generations. So that's the third kind of harm that we are looking at from fossil fuels infrastructure. Now, in addition to all these harms, let's focus on the climate-related harms. Why climate? Because the science is very clear that fossil fuels are driving the climate crisis. And thereby, what we are seeing in terms of the health impacts of the climate crisis, we're seeing increased extreme weather events. So more floods, hurricanes, fires, droughts, extreme heat. We're seeing, so there is a whole, segment of disasters and harm that these extreme weather events have on people. Then we're seeing increased changing patterns in vector-borne diseases, increased waterborne diseases, increased diseases because of salination of water and sea level rise, increased health impacts because of food crisis and malnutrition. Then there is social conflicts because there's migration, and migration brings its own complications. There are social conflicts. And so there is a whole range of disastrous health impacts because of the climate crisis. And that's primarily being driven by fossil fuels. Now, one bit before we take a pause, who is the worst affected? And it's important to remember that those who are most marginalized and most vulnerable and have least contributed to this problem, to this crisis, are at the receiving end of the worst impacts of the climate crisis, of the fossil fuel crisis. Now, this is analysis done by a Global Climate Risk Index, which shows that 8 out of 10 countries who are most vulnerable to climate crisis are low and middle income countries. These are economies that have least contributed to the crisis and have least resources to cope with the crisis, have been repeatedly being battered by one after another by extreme weather events or climate-induced disasters that is further affecting their ability to return back to normal or bounce back to normal. So people who have least contributed, who are most vulnerable, most marginalized, are at the most, highest receiving end of this crisis. I am going to take a pause over here, and it'll be good to hear. So I'm going to stop screen share, and it'll be good to hear your thoughts or any comments that you have or any questions that you may have.
Thank you, Shweta, for this wonderful overview. Yes, the floor is open if you have any questions, or if you'd like to share some of the experience that you are having in your country as health professionals. Are you seeing the harms of fossil fuels, and what exactly are you witnessing in your country that you know for sure or suspect is caused by fossil fuels? We are eager to hear from you. And thank you for connecting from all around the world. I wanted to explain, while you're thinking, the slides are in Spanish. The talk is in English. We're trying to create a more inclusive, friendly environment for our participants that are speaking Spanish. Julie, and we usually have the slides in English, so for a change. But later, after this session, we will share both in English and Spanish, the recording and the slides as well. Okay.
Milena, I think there's one question in the chat from Bhupendra Rana on which age groups is most vulnerable to fossil fuel impact. Again, I think there are more qualified experts in the room today who can talk about it, but all the research that we have looked at is every age group in the human life cycle is vulnerable to the impacts, the toxic impacts of fossil fuel emissions and operations. I mean, of course, there are children, pregnant women, and elderly who are classified as more vulnerable than others. But if you look at the toxic impacts of these chemicals that are released in the process, it makes everybody equally vulnerable and impacted in various ways. In fact, there are certain chemicals, again, I talked about chemicals and their intergenerational effect. There are certain chemicals that the exposure may have happened in among children, but the effects show up only at a later stage. So like there are a whole bunch of reproductive toxins where the exposure may have had when children between the age group of 5 or 6 or 7, but because they are reproductive toxins, you will start seeing the impact at the age of 12 or 13 at the time of puberty. So there are reproductive damages that happen very early on, but it only shows in terms when the child attains that age group. We have examples. I saw somebody mention Nigeria. I mean, again, the horrific health impact, the average life expectancy in Nigeria, which is, again, the Niger Delta is the hub of oil. And the average life expectancy because of contamination is 41 years in many places in Niger Delta. There have been reports now, there was most recent report that came out last year that did a documentation of blood samples among women in the Niger Delta. And they found that 100% samples showed hydrocarbons in women's bloods. There's also research and evidence that shows that women get menopause at the age of 25 in that area. So that's the kind of severity of the chemicals and its impact, chemicals from fossil fuel operations and its impact on human body. And I'm happy to share these reports later. May I just go ahead with the second part?
There are a couple of reactions and comments in the chat. Jose Chen from Portugal says that some chemicals are endocrine disruptors.
Yes.
Yes. Also reporting that the Hurricane Kirk caused much damage, but it is hard for health professionals to see the link, which they see as a very indirect one. Yeah, this is why we are trying to visualize this link. Every age group is affected, says Anyedi, and she also adds that in the Niger Delta, in Nigeria, south is vulnerable due to oil exploration and exploitation, lung cancers, and other forms of disease, and flooding is reported in the Niger Delta region. Thank you all for sharing from your countries. I hope I didn't miss anyone. Charlotte says there have been also floods in northern parts of Nigeria and Cameroon this year.
Yes, and I apologize if I've missed out any countries. That was just a representation to show the extent, but that was in no way an exhaustive list by any chance. So, yeah.
Thank you for sharing, Shweta. You can go ahead.
Perfect. Let me just share. So then this brings me to this question, and I think we have the stage set in our conversation. Then what is the role of the health professional and the health community? And that's where I'm actually terming it as a solution, because I personally, and I think it's important to understand that health community plays a really, really important and impactful role in taking on this climate crisis and in ensuring that there is just and equitable climate action. Now, why the health community? And I'm sure you've heard this a number of times. I'm just showing one slide in terms of the evidence that is there. This is the Global Trustworthiness Ranking of 2023, which shows, and I think doctors are the representative of the health community. I would like to call it the health community, which is among the most trusted messengers in the world. And it's I mean, I'm not at all surprised when I say that politicians are the least trusted messengers. But this is the ranking that was done through assessments in 31 countries and assessing over 22,000 or almost 23,000 people. And this data speaks volume in terms of the power and the credibility that the health community has. And in the next few slides, we'll talk about the rich history that the health community has that gives it the entire mandate to take on to the climate crisis. Now, I know that, and I'm looking forward to this conversation later, that the health community witnesses some of the evidence that we talked about, some of those impacts that we talked about earlier on a daily basis. They see it in their clinics. They treat patients who are affected because of extreme weather event or air pollution or any kind of toxic exposure almost on a daily basis in some of these regions, and have that evidence, and that makes them credible and trustworthy because they're seeing this on a daily basis. Now, before I go into the next slide, I think it's important to recognize that as a community, the health community has influenced and shaped the society the way it is today for over 150 years. And this is important to remember. And this is where the health community gets its mandate to tackle the climate crisis. In 1854, to take an example from cholera in UK, in London, You would be surprised to know that before Dr. John Snow linked contaminated water through his research, linked contaminated water to cholera, it was popularly believed that cholera was caused because of um, uh, smell and stinky odor. That was the belief. It's very hard to believe today, but that was the belief prior to 1854. It was in 1854 that Dr. John Snow, by doing community mapping, disease mapping, speaking to residents in the community, speaking to a wide range of diverse actors in Soho in London, mapped out that it was a contaminated hand pump that was causing the spread of disease. And to my right is this image of this Broad Street pump in Soho. And the entire evidence pointed out to that pump and as a source of contaminated drinking water. And symbolically, the hand was removed so that nobody could access that drinking water, but that pump is still there as a remembrance how health documentation led to that conclusion. What this entire effort also led in identifying that it was certain companies that were contaminating the groundwater with sewage, and that led to legislation of sanitation acts, legislation on action on violations, and very robust urban planning laws, not just in UK, but around the world, to ensure that public health is protected. That was 1854, and that was the health community's leadership and evidence that led to that policy decision. More recently, in the 60s, again, and this is important because I'm taking some of the reference of environmental health and public health because with limited time, I'm looking at like three very, very important landmark cases. Now, this was in the 60s when there was a concerted effort by coal mining companies to cause doubt or denial in coal miners about their concerns of getting black lung disease, which is a life-threatening disease. It's coal mine pneumoconiosis. And corporations and coal mining companies were denying it by saying that, it's good that, in fact, they went to the extent of saying that it's good that coal miners have pneumoconiosis because that averts tuberculosis. So that's the manipulation that companies did. And it was 3 doctors in the miners hospital, Dr. Donald Rasmussen, Dr. I.G. Wells, and Dr. Buff and Dr. Wells, sorry, apologies for getting the names wrong, who came together and they started looking at and analyzing lung x-rays of coal miners to see the extent and document the extent of damage. And in their hospitals, they evaluated over 40,000 x-rays to reach to a conclusion that black lung disease was indeed a grave threat to the health of the miners. But they didn't limit themselves in generating this evidence. They used this evidence then to advocate for better policies. They testified in courts and in senates. They even educated the workers about the dangers and the need for protection. They even joined the workers in strikes and in picket lines to lend solidarity with their evidence and their credibility to advance workers' rights. And as a result of all these concerted efforts in 1968, the Black Lung Disease Law was passed that mandated compensation, that mandated protection, treatment, and benefits to protect the interests and the lives of the coal miners. And that was a very remarkable milestone, important milestone in the health advocacy space, where evidence was generated, used both to support communities and to inform better policies. My most recent example and my last example of the 3 is from the 80s. And this is about the nuclear war. Now, who would have thought that nuclear war is a health issue? And at the peak of the Cold War, doctors, and actually 2 cardiologists, one from America and one from erstwhile USSR, came together and understood and reframed the whole issue of nuclear war as a health issue, where they went out to mobilize under the banner of International Physicians for Prevention of Nuclear War, which was set up in 1980. And they went on to mobilize the entire health community around the world by educating them, by generating information to show the grave risks of a nuclear catastrophe. And that risk was such that they went on to show that if at all there was a risk and a catastrophe like that, the health systems will be completely overwhelmed and will not be able to cope with the casualties and treat people or protect people. From 1980 to 1985, the massive mobilization that health community brought won the IPPNW with a Nobel Peace Prize. And in the citation of that Peace Prize, the Nobel Committee said that because they reframed this political issue into a health issue, that changed the dynamics of the conversation and brought attention from the whole world. Now, if we have done this with nuclear war, I don't see why we shouldn't be doing it with the climate crisis. And indeed, if the way the climate crisis is accelerating and exacerbating, it will totally overwhelm our health systems. We will not be able to adapt or cope with a 2 or 3 degree warming world. And that means that we need to address the root causes of the crisis, and we need to take that leadership. Now, in these 3 case studies, there are certain common strategies that were applied, and that becomes the basis for us to start incorporating it in our climate action and in taking on the climate crisis. And these strategies were evidence-based knowledge, education of the impacted stakeholders and public, legal action, policy change, cross-social solidarity, and mass mobilization and support. Now, when I say this with full gravity. I know that health community is already overburdened and exhausted with the current workload. By no means showing these case studies mean that the health community has to take the leadership and fight every fight. That's not what I'm trying to say. What I'm trying to say is that health community has a very important role and should and must recognize that role and contribute in the growing movement for climate justice and equity. That means if you have evidence, we must share that evidence. Generating that evidence is not going to be enough. Actively sharing that evidence is going to be important. If there are groups that are taking governments or corporations or fossil fuel companies to the court for holding them accountable for the climate crisis, the health community has a role in providing testimony and testifying in the court. We have a role as a health community in every aspect of pushing for climate action and taking on climate crisis, and we must occupy that space and use that role. Now, just to sum up, the way we see health community act, and we have talked about in the earlier case studies, the evidence that the health community sees on a daily basis can be used to validate communities' concern. When communities talk about their lived experience of health impact, they are residents who are talking about this health impact. The expertise comes from the health community. They're documenting that evidence, and that evidence can validate communities' concern. That in turn strengthens the community to demand for better policies. At the same time, the evidence that health community has can be used for evidence-based policy making. We can support the policymakers with this information for them to take the right decision and take urgent action. So at both levels, so I would see, if you imagine the structure, the health community is at the forefront, at the center of the structure, where in one way they're supporting communities with evidence, and at the same time, they're also supporting policymakers with evidence-based action. And health is such a strong argument. Health is a shared concern. It has the power to transcend boundaries across race, class, caste, across generations. One thing that brings us together is our shared concern about our health, our children's health, our family's health, our community's health. We really need to articulate that concern more strongly and leverage that concern. Health actually humanizes the impact of climate crisis. Otherwise, we see climate crisis in terms of numbers and degrees. Health actually makes it real. The impacts of air pollution on lungs, on our children's health, the impacts of the disasters on our communities, the health argument makes it absolutely real. So that's the role of the health community. And that brings us to this, just two more slides, so please bear with me, brings us to the argument of what is the way forward. The way forward, with all that evidence that we have seen so far, is that we need to address the fossil fuel crisis. We need a just transition away from fossil fuels, and we need a health-based just transition away from fossil fuels. Why health? Because health is foundational in any decision that we take. And if health is not a foundational consideration, then the actions will not be just or equitable. And when I say this, it might sound confusing. We cannot treat health as a co-benefit, because health as a co-benefit will bring the benefits, but it might not be just and equitable. And I'll just use one example for this. We are faced with a transportation problem. We know that fossil fuel transportation is polluting our air and is driving the climate crisis. Now, if you think of health as a co-benefit, that means currently replacing private cars with private EVs. Great, the air quality will improve. But the fact that private transport excludes a large segment of population from transport access continues. So a private car replaced by a private clean technology gives you the health co-benefit if you're looking at health as a co-benefit, but might not be just, because it does not include those people who are excluded from transport access. While if you think of health as foundational, then you will be forced to explore for options that are more public transports, more walkable areas, more cycling tracks, more accessible way of transport that is not polluting, that is not fossil fuel based, and that includes people who have been left out from the traditional transport system or the mainstream transport system. That's the difference between health as a co-benefit and health foundational. So we really need to push for health as a foundational consideration. We need to have health impact assessments. We need to have communities. And when we're talking about just transition, we need to ensure that the workers are included in the conversation, the communities, the frontline communities are included, the physical and mental health considerations are made, women, children, young people are included, and then we have an opportunity to repair the historical injustices through this process of just transition, and we must ensure that that's taken care of. Phasing out of fossil fuels is the largest and the most important public health intervention that we can take to resolve the climate crisis, to tackle the climate crisis. So with that, I'm going to end, and I'm happy to answer any questions that you may have. Thank you.
Thank you, Shweta. That was truly inspiring. There is an immediate reaction in the chat. E-mobility is great, only it is powered by, when it is powered by renewable energy. And of course, public transport should be the first choice. And this was a comment from Ioannis Tsipuridis. And now I see a hand from Sandra Serrato. Go ahead, Sandra.
Good morning. In my country is the morning. I speak Spanish.
You can.
En mi país creemos, como todo el sur global, estamos muy preocupados y expresamos nuestra profunda preocupación ante las prácticas de la tala excesiva de árboles. Los incendios forestales pues han devastado vastas extensiones de los bosques en nuestro país. Es evidente la falta de regulación y la aplicación efectiva sobre estos componentes humanos y empresariales, entre ellos la industria, generación eléctrica y transporte, entre otros. También cabe destacar que la economía hondureña aún depende de gran medida de la generación de energía a partir de los combustibles fósiles, como el carbón, el búnker, cuyas emisiones son altamente nocivas para la salud humana y el ambiente. Yo, como directora del Instituto para el Desarrollo Sostenible de la Mujer Lenca de Honduras, y como ambientalista hondureña y haciendo incidencia a nivel internacional, pues para mí es lamentable y es preocupante. Ahorita recién vengo llegando de Tanzania del Campamento de Justicia Climática, donde se reúnen un número de 350 jóvenes de diferentes países del mundo para luchar por la justicia climática, porque sabemos que es un problema del sur global que nos está consumiendo. Sabemos que es fundamental en el caso de nuestro país asignar recursos suficientes para implementar mecanismos efectivos de monitoreo y control en la deforestación. Queremos instar a la adopción e implementación de políticas públicas que promuevan la descarbonización de la economía, estableciendo estándares más estrictos para la educación y la emisión de todos los sectores. Sabemos que es esencial impulsar la investigación y el desarrollo de tecnologías sostenibles con el ambiente que permita una transición hacia un modelo energético más eficiente. También yo como médico, porque trabajo como médico de salud pública en un hospital público, sé de las consecuencias del uso de combustible fósil y los problemas de cáncer que está ocasionando en mi país y en todo lo que es Centroamérica. Sabemos eh, la terrible situación que causa el ecosistema, al ecosistema del sur global, y también nosotros como hondureños estamos preocupados de que en este país pues todavía no se ha firmado el acuerdo de Escazú y no hay ningún interés de parte del gobierno de firmar ese acuerdo, porque sabemos que es un instrumento fundamental para garantizar el acceso a la información y a la participación pública, a la justicia de asuntos ambientales en América Latina y el Caribe. Y nosotros desde acá, pues como hondureña, como directora de una institución indígena lenca, no gubernamental, pues exigimos al gobierno de Honduras la pronta firma y ratificación de este acuerdo sin demora, porque nos estamos muriendo. Es preocupante y queremos que el gobierno demuestre su compromiso con la protección al ambiente y a los derechos de las comunidades y los pueblos indígenas y afrodescendientes afectados por la contaminación. Y para finalizar, pues me da mucho gusto y placer saber que estamos mucha gente, muchas organizaciones del sur global, muchos profesionales de la salud trabajando en este proceso ya de varias sesiones que tenemos, son más de 15 sesiones en las que vamos a culminar, y creo que es algo que hemos aprendido, hemos hecho incidencia, hemos hecho sinergias, nos hemos hecho más resilientes al escuchar cada práctica nociva que hace cada país y los problemas que están afectando a cada país. Les mando mi más sincero agradecimiento a los coordinadores de este evento, porque de verdad que han sido un baluarte fundamental para fortalecerlos como ambientalistas y nos han ayudado a creer que no estamos solos ni solas. Y gracias al equipo por darnos la oportunidad, a los trabajadores de la salud y a las organizaciones de sociedad civil en estos encuentros tan importantes. Muchísimas gracias, Milena, y todos los que están presentes.
Muchas gracias, Sandra, de todo corazón. Qué bueno saber de tu dedicación, de involucrarte más, de trabajar en el hospital, de también involucrarte en este movimiento por la justicia climática. Gracias por seguir nuestras sesiones. Es un honor tenerte aquí con nosotros. Y felicidades también por su trabajo en promover el Acuerdo de Escazú. Conocemos su relevancia respecto a la transparencia de información ambiental que debería entregar cada estado, y también en la protección de los defensores del medio ambiente. Y otra arista muy importante es la participación ciudadana que garantizaría el acuerdo si entra en operacionalización, para discutir cada proyecto que es de de preocupación ciudadana que se va a instalar cerca de alguna comunidad y para poder tener la aprobación, las condiciones de la comunidad para poder garantizar que su salud sea protegida. Muchas gracias. Y seguimos con, creo que Raymond y Charlotte.
Yeah, thank you very much. And thank you very much for this session. I would to appreciate the submissions. Thank you, Shweta, for the submission, especially the history, how the fossil fuels have come, and the impact it has on the communities, especially the role of health communities in addressing fossil fuels. I'm Raymond Rioka. I am a public health specialist with an interest in environment and climate. And I come from Africa Climate and Health Alliance. That is a new alliance we are creating in the Africa continent with our memberships of 38 countries to advance the climate and health nexus in Africa. And happy to and appreciating CGHF for the support and the mentorship in this agenda. I also speak basing on the submission of Shweta, especially on another hat which I hold. I'm the chairperson of the board of the Global Alliance on Health and Pollution, GAP, that's based in Geneva, Switzerland. They're talking about fossil fuels and the impact has in relation to pollution. I speak basically basing on the work we do. GAP, the countries we work in, be it India, Vietnam, Senegal in Africa, and other countries we operate in, we see a lot of challenges emanating from pollution that come from fossil fuels. So talking about the role of health communities, it is imperative to address pollution. We have a challenge of lead and mercury that is making lives of children, especially blood lead levels, getting high. Talking about the health challenges that they come from respiratory challenges, all these emanating from the impact of the fossil fuels. So it is imperative as we talk about addressing these. We have an upcoming COP ongoing, upcoming in Baku, where these are the table. The financing for addressing fossil fuels, the financing mechanisms, how can we help us to ensure that the health sector is made resilient to climate change? Flooding, we see all these challenges that are affecting the health sector. So talking about fossil fuels, it is imperative that we talk about aligning with governments and commitments. We are seeing the COP29 being a channel that is going to help us to address the challenges that emanate that affect the health of communities. For us who work in the health sector, we see this happen every day. Communities, women dying, children dying. So it is imperative that we advance climate resilience of this health sector and addressing this challenge therein. So I think strengthening coordination and holding government accountable. I'm happy for my country, Uganda. Last month, they launched the Health National Action Plan, the HNAP. So if we can have other countries do the same, to have the health and national adaptation plans to ensure that all these health challenges are addressed in the emanating from climate. So I think, thank you for submission. We believe that having these vulnerable communities had, especially at the center, especially women and girls, being at the center of addressing of the climate negotiations for their health is very important. Thank you very much, and happy to join the session. Thank you.
Thank you so much. And I give the floor to Charlotte. Please, you can unmute. Yeah.
Okay, thank you very much, Milena. I actually put my comment in the chat because I was conscious of the time. I'm Charlotte Mbu from the Geneva Learning Foundation. I'm a public health specialist, and over the past 1 year, we have been paying a lot of attention to what health workers are telling us about the impact of climate change on the health of their communities. And I don't want to come back to everything that has been said, but I really want to thank Shweta, and it's good to see you again for the presentation. It was it's quite eye-opening. So to me, it's really about taking the message from the global stage to the local stage, to the communities, maybe to the homes, because my real worry is that when I move along the streets in my country, you see the way people dispose of waste. You see the way people do farming and everything. And so it's really trying to bring the communication. And I know that usually people no longer really trust government and politicians, but they trust health workers. Health workers are trusted advisors of the community. So if we can get to a point where health workers are conscious and are aware of climate change, of the impact of fossil fuels, and then get to that level where they can take concrete action. That is, at times it doesn't require resources, it's just health education. And then now community members develop a conscience, just like we have a conscience where we want to do something wrong, tell you, if I burn, if I do my farming by burning of the waste and everything, how does it impact the climate? So I just think little actions like that, if there is a way that we can really amplify the communication, and it should be everywhere, in the schools, in the homes, in churches, wherever people gather, the same way we are advocating for immunization. If we can advocate for climate, then that would really be great. And I just wanted to end by asking if there's anyone here that is attending the Climate and Health African Conference in Zimbabwe next week. It will be good to connect there. Thank you.
Thank you so much, Charlotte. If anyone is attending, you can react in the chat. And Shweta, I wanted to ask, does anyone want to speak up? I hear it seems that no. I wanted to ask Shweta if she can disclose any details on the upcoming resource for advocacy that GCHA will have soon for you all.
Thanks, Milena, for requesting me to do that. This is quite exciting. In fact, what you all saw in the segment around health impacts of fossil fuels, the various streams, we are currently working on a report, a 2022 report that GCHA had produced. We are working on making it more detailed and substantiating every health impact that we've talked about or we've seen through research. And that report is it's under review right now by experts, and that's likely to be out in January. So what you today saw was a sneak peek, a special preview of an upcoming report, and we're really excited about that report because for us it serves two purposes. It helps the experts like yourselves, medical and public health community, with evidence, research, well-researched evidence to state everything that we want to state about health impacts of fossil fuels. It also provides substantial resources and evidence to the communities for them to argue or relate to whatever health impacts they're facing. So we're quite excited about it. We'll keep you all posted. And once the report is out, we would be very grateful if it's amplified across your networks.
Thank you so much, Shweta. I see that there is excitement in the chat. And also going back to what Sandra was mentioning in her intervention about wildfires in Latin America and the Caribbean, even sooner than the fossil fuel impacts report, we are launching possibly in the next 2 weeks a document, a policy document on wildfires, climate change, and health that was conceptualized and drafted by the Latin American network within GCHA. So we're also going to be sending that out to you and hope that it will be useful. Does anyone have another comment or anything to share? I saw somebody unmute. Okay. Then I'd like to say that the next session of the pilot course on global engagement in climate and health will be most certainly on the 6th of November, but I will be writing to you all to inform you about that and provide a registration link. So this session will be about the policy recommendations that the health community collaboratively synthesized in a document that will be distributing to all of our members and partners, and will be bringing to COP in Baku. So I hope to see you all in the next session. Thank you so much for following up with all of the course, and have a good rest of your days.